a lot of discussion, a lot of right now is focusing on the COVID-19 pandemic. And so this presentation basically sort of talks a little bit about health equity in the context of the pandemic. So before I begin, just no conflicts to disclose. The key objectives for today's visit is to identify factors that contribute to the health inequities and exacerbate disparities, particularly in the context of the COVID-19 pandemic. Discuss behavioral health inequity that we have some initial data on within the context of the pandemic, outline principles of health and social justice frameworks that can maybe guide some activities to help you address these issues, and then describe the role of community engagement and advocacy right now and then also beyond. So my goal for the end of this presentation is to spend some time talking a little bit about what you can do as an individual, what you can do in terms of your agency, and then why you might be willing to take actions. So a lot of discussion around the COVID-19 pandemic is currently ongoing. And one of the discussion points, the issues that comes up is this notion that COVID-19 is the great equalizer. Whether that's actually true or not, we'll take a look at that. So while that's a discussion point, we see some of these,
Marilyn,
yes.
This is Jamie. I just wanted to let you know that your audio is becoming garbled.
No problem at all. Thank you for letting me know. While this is a question sort of COVID-19 as the great equalizer, we see some of these headlines in the news. American inequality meets COVID-19, Black and Latino residents hit particularly hard by the pandemic, COVID-19 exposing inequities in rural districts. So not just the immediate impact of COVID-19 on physical and medical outcomes, also as we are trying to address sort of life in context of COVID-19, education, things like that, we're also starting to see inequities there related to digital learning. And then we actually see the things that we are most concerned about right now, which is morbidity and mortality. So when we look at state data, and these are other states, so not specific to Ohio, I do have a slide on Ohio I'll get to in a second, but we're looking specifically at the COVID-19's devastating impact on communities of color. And so we see in several states, specifically here, outlining on your left of screen, Louisiana, Illinois, up to North Michigan, North Carolina, Chicago, Black and brown lives are accounting for a larger percent of the population that's being impacted medically into the morbidity and mortality by the pandemic than would be affected given their share of the general population of the states. The same is happening in King County and Washington, where thought that this pandemic sort of initially started. But we see just a larger share in the morbidity and mortality data among these communities of color. Okay, all right. We're going to try this again. Sorry, guys. Really do apologize. So we just see sort of that disproportionate impact on our communities of color in terms of the morbidity and mortality. When we look at the data here in Ohio, we also see some of that disparity. So on the left side of your graph, you're going to see sort of percentages for the patient population who has been hospitalized due to COVID-19 related issues. On the right side of the graph, you will see percentages for the general population of Ohio. And so when you look at our Black African American communities, again, you see the sort of the same pattern play out, which is a higher percentage being reflected in our hospitalizations compared to what you would expect given their representation in the general population. So the answer to that question, is COVID-19 the great equalizer? The answer is no. COVID-19 itself, the virus, does not discriminate, but generally society does and things within society do. So why do we have these disproportionate burden on communities of color? Well, because we have a system, a complex ecosystem of disparity. We have persistent inequities that sort of overlay our societal system. I created this graph or this figure sort of with that in mind in the context of COVID-19. So if we think about it sort of at its larger umbrella, we think about discrimination in systems or at the policy level, which basically perpetuates systematic oppression. That creates those structural barriers or some of the structural barriers that communities of color or vulnerable communities may experience as a result of trying to access things like healthcare, quality healthcare. In addition, we have a sort of a pattern in the United States in terms of our policies. If you go all the way back in history and sort of look at it in terms of the granular level, where we really do concentrate health hazards in poor communities. So you think about air quality, proximity to plants that potentially cause toxins or allergens in the air that create higher rates of asthma. Those tend to be concentrated in areas where lower income or individuals living in poverty reside. Which creates those underlying health conditions. Maybe we don't have access to fresh food, so we live in food deserts. So it creates those disproportionate percentages of underlying health conditions like asthma, hypertension, obesity, diabetes, which is a complicating factor and likely contributes to worse outcomes in the midst of this pandemic. We also have communities of color who tend to, on average, tend to have a lower median income. And when that's the case, you have individuals who may not have that economic cushion, and so they can't afford to not go to work. They also may be essential workers working those jobs where they are unable to stay at home. And then we think about the mitigating strategies, so the recommendations around mitigating strategies and how they may not fit certain communities or certain populations. So for example, I'll just give you an example. My family, we live in a 3-generation household. There are 2 families basically living in my home. They're not able to necessarily socially distance in that way. And granted, that's just within one household. But given that there's many more people coming in and out as a function, and so maybe they're not able to engage in those recommendations the way that others are. When we think about disproportionate impact, and we've talked a little bit about racial and ethnic disparities, we also don't want to lose sight of income, as I sort of mentioned or alluded to. But what we do see is we see sort of a compounding of both income concerns as well as sort of the racial and ethnic disparities. Because at every level of age, what we have is a higher percentage of the individuals with lower income represented by Black and Brown communities. So what does that create in terms of behavioral health? So behavioral health equity is basically the right to access quality health care for behavioral health, regardless of background, regardless of demographic factors. And that is obtained through the prevention and treatment of mental health and substance use conditions and disorders. So getting that appropriate access to treatment and prevention. And then disparities is what occurs when we have unequal access or unequal distribution of those resources and creates those differences systematically. So in the context of COVID-19, we are starting to see some of those initial disparities in terms of behavioral health outcomes. If you look on this graph, which is from the Kaiser Family Foundation, they are already looking at to what extent is the coronavirus pandemic having a negative impact on mental health. If you look at just the disparity between males and females, you will see that females are reporting a higher percentage of both a impact overall, but also a higher percentage of major impact. If you also look at the sort of the third tier between the white, Black, and Hispanic lines, you will also see a greater percent of individuals in the Black and Hispanic groups reporting a major impact. And again, overall, individuals reporting a larger percentage of an impact in general. So contributing to those behavioral health disparities in the context, again, of COVID-19, we've talked a little bit about some of these, so I'm going to just kind of go down and highlight the ones towards the bottom. Daily stress of forced potential exposure. So as we discussed, because of economic concerns or because of the nature of one's job, there are individuals who are forced to be potentially exposed to the virus in terms of their general occupation. So they may not experience a physical or medical result from the COVID-19 pandemic, assuming they don't contract the virus, but just that daily stress of having to endure the possibility that has to weigh on individuals and maybe impacting negatively their mental health. As I mentioned, those barriers to recommendations when you're not able to stay at home. I have the privilege right now of being able to be at home and to work from home. Not everyone has that privilege. When you're unable to maybe do the social distancing to the extent that they're recommending, those are all things that play a role in terms of one's mental health. And then obviously there's just stigma related to behavioral mental health in these communities. The other sort of bullet points above are things I think we've covered in some aspects on different presentations, or you're already aware of in terms of sort of cultural and linguistic competency as well. The other thing I want to highlight really quickly on this slide is the fourth bullet point, racism, discrimination, and xenophobia. That's particularly something I want to make sure we also highlight in the context of the impact of the coronavirus on our Asian communities, and the discrimination and some of the rhetoric around that as well, which can negatively impact mental health. So when we talk about equality, equity, and justice, these are all terms that have sort of been thrown around in terms of how to address these issues. Which one are we really talking about? Equality versus equity, I think this is a little bit more understood in terms of the generic lexicon. Equality is assuming fairness, equity sort of giving people what they need given their starting point or given where they're at. So sort of allocating resources based on need. The reality of inequity, though, can feel quite different than what we may just assume. So think about it again in the context of the COVID-19 pandemic. If you look at what that might feel like in reality to some individuals right now, it probably feels a lot more like it does on the right side of the screen. And so then how do we sort of address that? Well, we address it through something called justice, or in this case, as it's identified on the picture, liberation. That's when we remove the barrier. So if you look at the other subsections of this picture, you notice that everyone is still behind a fence. You'll notice in the very last image, there is no fence. And that's basically a symbolic representation of eliminating the barriers that create those inequities in the first place. So when we start thinking about that, we think about social determinants of health and the distribution of social determinants of health and what really we need to be doing to basically create a more equitable playing field for all individuals. Ways to think about that are through the frameworks of social justice and health justice. These are two frameworks that have increased in popularity. Social justice really just sort of is based on this idea of fair and equitable treatment for all people, so that inequalities in health are avoidable. That's sort of the general consensus, and that by reasonable social action, they are unfair because they are avoidable. We can prevent them, and that society should work to ensure that every individual has the capability to be healthy. So this is not ensuring that every individual is healthy, but ensuring that everyone has things in place and the resources needed to ensure that they are capable of being healthy. And distribution of social determinants of health such that every individual has basically the same opportunity to lead their healthy lives. When we think about health justice, now we're thinking about it from the context of policy making. So knowledge of these social determinants of health and their distribution is integrated into the policies, which again, if we think about back to that initial figure I had, discrimination sort of at the policy level, creating that systemic or systematic oppression would have to be addressed. And that's done through policies, laws, and social structures designed to address those things. So with social justice, when we think about principles of social justice, they really are rooted in access, equity, rights, and participation. So access, just greater access and greater equality and access to goods, services, resources. Equity, focusing on overcoming that sense of unfairness by unequal distribution of resources and power. So addressing that unfairness. Rights, meaning that everyone has equal rights to protections, and then participation is that every individual has the opportunity to be involved in the decisions and the governing that basically governs their lives. So what can we do in terms of a social justice framework right now? Well, understanding the far-reaching implications of the crisis on our vulnerable populations. So not just focusing on obviously the morbidity and mortality, but really the far-reaching implications, quite frankly, the long-term implications on these vulnerable populations. Recently, there's been some discussion that it's going to take estimates or projections that it's going to take at minimum a decade for our vulnerable populations to recover from this pandemic. Focusing on systemic and structural change, those are, again, those larger systems that we really need to try and make some headway in terms of being more equitable, and advocating for marginalized communities and those most vulnerable. So those are the overarching steps. When we talk about health justice, basically the principles are just equal rights, equal opportunities, and equal treatments. And so when we're thinking about policies, they really should sort of internalize these principles. And so what does that look like on the back end? Sort of every sort of policy-making response really should address those social determinants of health. When we think about those mitigating strategies, there should be policies or procedures in place to allow folks to engage in those mitigating strategies in an equitable manner. And responses must address immediate needs and root causes. So we can't just treat the symptom. We can't just put a Band-Aid and slap it on the wound and say, hey, we've done our job, but we've got to address the root cause of those issues. So ways to move forward. So these are sort of more geared towards what can you as an individual or you as an agency do. We'll sort of start at an agency level. So ways to move forward are to engage your communities. So really try and understand the experience and the needs of those impacted by this pandemic. So really, whether that's in intakes, questions on intakes, there's a new survey out that is available, and certainly you can reach out to me if you're interested. I can sort of direct you to it, but it's called the COVID-19 Exposure and Family Impact Survey. It's meant for research, but I think actually has some clinical utility as well. And it really goes through what have these folks actually experienced and what are the collective needs or collective experience that they have had. In order to really understand and address those, we need to really understand what that experience has been, sort of like a journey map, if you will. Develop partnerships with these communities. So again, we're focusing on the communities, and so developing partnerships, not just with key stakeholders in the community, but also maybe the agencies already working or doing the groundwork with these communities. That can be grassroots organizations, grassroots partnerships. And it's really important to centering communities. I think sometimes there are efforts where we maybe think we know the community needs, we think we know what their experience has been, but perhaps we don't have the full picture. So really centering communities in our work and putting them at the forefront and in the middle and sort of building outward. And so I like that this quote just sort of captures it. It's been attributed to various sources, but this quote about nothing about us without us. So we don't do anything for communities without their input, without their buy-in, and frankly, without centering them at the forefront. When we think about advocacy, really an equity plan. As an agency, does your agency have an equity plan? Do you have a strategic plan for equity or behavioral health equity? That's something, those questions you can start to ask now. And if you don't have an equity plan, what would it take to maybe start one or put one in place? What is maybe your first step as an organization or agency? In terms of funding, as just recently announced by the governor, there are going to be some cuts to education, Medicaid, some significant cuts, budgetary considerations as a result of this pandemic. And what I would really encourage is that for, with those cuts or with those budgetary considerations, if there's any cutting of funding that goes to offices of diversity, inclusion, equity, or for those roles or sources, to really try and advocate to keep that funding in place. Because we want to make sure that we're doing what we can to make sure that there are things in place and even individuals in place to lead this work because it's difficult. We want to make sure that we have the supports and resources available to even start it. And then thinking about investment. So when we advocate for investment in these communities of color or in these vulnerable communities, as a country, the United States has a legacy of discrimination and disinvestment in response to crises. So we want to make sure that we are focusing on investing in our communities, and what role maybe does your agency play in doing that? And again, I like this quote by Cesar Chavez. We cannot forget about progress and prosperity for our community. Our ambitions must be broad enough to include aspirations and needs of others for their sakes, but also the sake of our own. And then what can you do right now? My first bullet point is question. If you see gaps, or if there are areas where you think like, how is this fitting for this population? Or are we serving this population? If you have any questions, make that question or ask that question. Identify those gaps in services or in service delivery, and then try and generate those questions for your agency or for your group. But you can do that as an individual, noticing those gaps and then questioning whether or not we're addressing those gaps. You can also combat misinformation. Right now with the COVID-19 pandemic, we have a lot of misinformation that's being disseminated. And as an individual, you can work to combat that. And the reason that I encourage that is not just for the sake of combating misinformation, just for the sake of doing that, but also because misinformation can also impact policymaking, can impact decision making. And so what can you do to help combat misinformation. And then civic engagement as an individual, making sure that you're voting, making sure that you're filling out the 2020 census, because those funding decisions at a state level are based on numbers and numbers of constituents, and encouraging others to make sure they're also filling out the 2020 census. We're sort of in a challenging time to be having the census because we don't have the ability necessarily to go door to door in the way that we used to. So encouraging others to make sure that they're also filling out the census, particularly in those vulnerable communities, to make sure that they're counted. And some of these things are captured in this quote: "I alone cannot change the world, but I can cast a stone across the waters to create many ripples," by Mother Teresa. The other thing I did not mention here, but it's just come to my mind here as well, is to engage in bystander intervention to the extent possible. So if you see, episodes of discrimination, racism, xenophobia, and you feel like you want to intervene, but maybe don't know how, there are frameworks for bystander intervention. There's one I particularly like. It involves 5 Ds. And again, if you have more questions, we can talk about it offline. But it's distract, delegate, document, delay, and direct. These are all different actions you can take as a bystander if you need to intervene in a situation that is casted in racism or xenophobia. And then what we need to remember, I think, is we need to center we. When we actually, as a human population, I guess, we do actually respond to crises normally by coming together. I think we lose sight of that sometimes, but in general, that has been one of our approaches, is to come together. And I think we need to center that we, and remind ourselves that we all share fragility, we all share vulnerability, and we share humanity. And if we can create work, policies, things sort of with this in mind, I think it actually will, it can go far in terms of making progress in this space. Because we are only as safe and as strong, frankly, as the most vulnerable among us. And so we want to make sure that we're taking care of our vulnerable communities. And one way we can do that, again, individually, is to demonstrate cultural humility, which is something I talked about, I think, the last time I did a presentation. But basically, I like this quote. It just means to be culturally humble means I'm willing to learn. We're not necessarily the experts on everything. And so making sure that we always sort of come from a place of humility, especially when we're working with communities with whom we may not be able to completely understand their experience, obviously. But that means that it's more important than ever to be willing to listen and to learn from them. And then the last thing I'll leave you with is this. I think we have, right now we have sort of an obligation, I think, on some level to help our communities right now, but also help them recover. But we also have an opportunity to sort of hit a reset button on some level, and to rethink, reimagine, redefine how we choose to address behavioral health equity, or just health equity overall, in a way that prioritizes justice and not just us. So I'll leave you with that. And these are some tools. If you're more interested in finding out more resources, one of the things that's come out from this pandemic is there is a slew of resources related to equity. So I encourage you to check a few of these out as well.